Sculptra is a wonderful product made by Galderma. It's the only FDA-approved polyallyl acid facial injectable treatment that works with your body to help stimulate natural collagen growth. It's different than hyaluronic acid fillers that you may be used to, dermal fillers, because it's a biostimulator. So it addresses the underlying cause of aging from within, so loss of collagen. What it does is it stimulates the fibroblasts underneath the skin when we inject it and helps your body to build collagen and elastin. That will restore your skin's natural facial volume and give you a little more fullness, and that fullness that we lose as we age. Sculptra was first introduced in 2009. It was discovered because it was being used for HIV patients for the lipoatrophy that they would experience from their disease. They had such amazing results in restoring the fullness for these patients that they decided to move it into the cosmetic world. Initially, there was a different reconstitution for Sculptra, and there were some issues with difficulty in injection and also getting small nodules where there would be clumps of the product. Since then, they did a relaunch and in 2019, and there's a new reconstitution and an immediate reconstitution that was just approved. This has made that really a non-issue. It's very easy to inject, and the nodule formation has not been seen with this new reconstitution pattern, so it's been a great product. So you can expect a specific regimen for your face when we start to talk about Sculptra. So someone who is older will need more vials because they've had more volume loss over time. Someone who's younger may just need a maintenance vial each year to maintain the volume, the collagen loss that they're having. So we lose about 1% of collagen each year starting at the age of 30, which is quite scary. So this is a wonderful product to kind of maintain your results, to continue to have natural results over time. So an example is for each decade of age you would need about 1 vial of Sculptra to kind of build that base. And then after that, once we do that initial series of treatments, you're going to have about a vial each year to maintain your investment. So for example, someone who is, say, in their 40s may need 4 vials. We never do all 4 vials in one treatment. We would be doing 2 vials in one treatment, and then I'd have you come back in about 4 to 8 weeks and you'd do another set of 2 vials, and that would complete your treatment, and then you'd come back annually to maintain that. So when we reconstitute Sculptra, we do place 1 milliliter of lidocaine in there to make the injection comfortable. And then my reconstitution is with then another 9 mils of bacteriostatic water or sterile water. And then we mix up the Sculptra, and what gets injected in your face is the liquid part of the vial. So here we have the beautiful Robin, who needs nothing, but we are going to get her started on her Sculptra regimen today, just to help replace that collagen loss that she's had over the years, and make sure that she stays looking young forever. Areas that I see that she could benefit from a little bit of volume are through her temples. We can also place it right in front of this preauricular hollow right here and submalar hollow. As we age, we tend to lose volume here, and it contributes to a fullness that happens more forward on the cheek. So those are the areas mostly that I'm gonna focus on, is the outside of her face to help give her that volume, because that's gonna help give her a lift to the skin. We can also place a little bit through the anterior cheek here and then move laterally. As her treatment progresses, we can start to focus a little bit on some of these areas that have lost volume, but I find that if you can build volume laterally, you get the best and most natural results. So first, for injecting Robin's temples, this is a wonderful area for Sculptra because we all lose volume in our temples, and it's an area that we don't always think about. So I'm going to inject, and I inject deep on her periosteum. This is an area where you have high fibroblast activity, not as high as in the subcutaneous plane, but still high. And so we can get a nice result of build of collagen and elastin in this area. The injection is with the water carrier, so it's kind of fantastic right after because you do have what looks like a full face of filler post-injection, but that all will go down and you will look like you did the day you came in after everything is healed. So the next area that I'm going to treat is right in front of Robin's ear. We call this the preauricular or submalar hollow. And this is a superficial injection because we're really trying to stimulate that skin to not only give her volume, but it also helps thicken the skin by building that collagen and elastin, which can give people what we call a beautiful Sculptra glow. After your Sculptra injection, you can expect a nice massage. This is the best part of the treatment.
Yes, it is.
The massage is, number one, to help disperse the fluid around and make sure that you have a uniform treatment underneath your skin. But number two, I'm also showing you how to do the massage at home. So one of the most important post-care instructions for Sculptra is the at-home massage. Massage will be for 5 minutes, 5 times a day for 5 days. And you're going to use about the same pressure that I'm using as I do the massage post-treatment. And you're going to massage in the areas that I treated you. This helps prevent post-treatment nodules, which can happen if some of the product gets clumped in one area. This is a less common side effect with the new reconstitution like we talked about earlier, but the massage will help ensure that that doesn't happen. So Robin is feeling nice and plump right now because of all of that water that we injected into her face. And I always like to remind clients that all of this swelling and fluid is going to go away and they're going to look exactly the way that they did prior to the treatment. And then over the course of about 3 to 4 months, they're going to start to notice that collagen and elastin production. That production varies per person. Some people it's a little bit faster and some people it's a little bit longer. So I like to tell people that after their second treatment to wait about 4 to 6 months before they really start to kind of assess what their results are. So Robin, she'll come back in about 5 weeks for her next treatment, and we'll do another 2 vials, and that will complete her series.